Good afternoon. This is a courtesy announcement that the meeting is now live on the web. Thank you.
Good afternoon, James.
Good afternoon.
Good afternoon, Robert.
Howdy, how are you?
Good, how are you?
Good, thanks.
Good afternoon, Margaret.
Good afternoon.
Margaret, your volume is a little bit low.
Okay, I'll try and
That-
increase it.
That was better.
Okay, thank you.
Good afternoon, Kova.
Good afternoon. Who am I speaking with?
This is Rhonda. I'm the
Hi.
host of the meeting, and you are our Spanish interpreter, I understand.
Yes, I am Rhonda. Very nice to meet you.
Nice to meet you. Thank you for joining us.
Absolutely. Rhonda, can you tell me a little bit how are we going to work the interpretation?
So basically, if there's a public comment that is in Spanish, we just ask that you translate it.
Perfect.
We don't know if we expect anybody or not, but we like to have you on hand just in case.
Perfect.
Thank you.
You're very welcome.
Good afternoon, Megan.
Good afternoon, Rhonda.
Good afternoon, Renee.
Hi, good afternoon.
Good afternoon, Supervisor Wasserman.
Good afternoon, Rhonda. Good afternoon, Susan.
Good afternoon, Rhonda, and good afternoon, Mike.
Good afternoon. Good afternoon, Sylvia.
Good afternoon. I feel like I'm early to a party.
It's all that awkward silence.
I'd project, but I'm not, I'm not starring in this show, so I'll just save myself for another day. I'm checking out.
All the hip people are here.
That's exactly right.
Did you just say hip?
I said hip, Madam Prez.
Okay, I just want you to, Susan, is that an old lady word or a, this is what she teases me about some of my language.
I was just going to mention how funny it was that you were commenting on Mike's language. Yes, since your slang is about 80 years old.
I know, I do have old slang.
I love it.
Thanks.
Hip is timeless.
Is it though?
I believe the current vernacular is it's dope. We're
No.
dope, maybe.
We should stop this right now. There's no good will come of us demonstrating exactly how out of it.
Hello, can you hear me?
Yes, we can. Welcome, Dr. Smith. So we are going to begin our budget hearing. And so what I would like to do is ask for the roll to be called, and then I will ask Mike to lead us in the pledge.
Supervisor Ellenberg,
I'm here.
Supervisor Simidian,
Here.
Supervisor Cortese. We'll come back to him. Vice President Wasserman
Here.
and President Chavez.
Here.
And one more time, Supervisor Cortese.
I don't yet see him on the line. We'll shoot him a text.
Thank you. We have a quorum.
Thank you.
You're shooting him a text, Madam
Oh, do
President?
you mind, Mike? That would be great if you could.
We need to do that before the flag. We'll do
That'd
that.
be great. And then if you're able, when Mike begins, please join us and stand for the Pledge of Allegiance.
Okay, I just sent him a text. Do you want to wait for a response or do you want to do the flag?
Oh, no, we should go ahead and begin. Thank you, Mike.
I pledge allegiance
Allegiance
to the
flag
flag
of the United States
United States of America,
to the republic for which it stands,
for which it stands,
under
one
God,
nation,
indivisible,
under God,
with liberty and
visible,
justice for all.
liberty, and justice for all.
Thank you, everyone. We're now going to go to public comment, and this is an opportunity to speak to an item that is not on the agenda, but within the purview of this committee. If you speak to an item that is on the agenda, I will ask you to not speak when that item comes up. So we'll give a minute for people to join us for public comment. All right. So we have 4 members of the public who would like to speak under public comment. I'm going to give each member of the public 2 minutes because it's below our 5. Oh, actually, I think I'm right about that. But we'll give each speaker 2 minutes.
Madam President, are we ready to begin the public comment?
Yes, please. Thank you.
Thank you very much. The next speaker is Kirk Vertan. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Good afternoon, President Chavez and honorable members of the Board of Supervisors. My name is Kirk Vartan. I am the founder and general manager of the Santa Clara Pizza Shop, a slice of New York, with a second location in Sunnyvale. We're the first and only retail worker-owned cooperative in Santa Clara County and hope to see many more businesses like us in the county soon. I'm providing comment today on behalf of and as a member of Worker-Owned Recovery California, which is a statewide coalition advocating for funding, technical assistance, and other supports from the state for worker-owned businesses conversions as a cost-effective method for preserving small businesses statewide. WORK has submitted a letter of support for the Santa Clara County's proposed small business loan program proposal, which is recently met with organization of the small business majority and shared information with your offices on the emergence of California Rebuilding Fund as a potential loan fund via the state's iBank and participating CDFIs. I also recently met with many of your staff and was encouraged to participate on the call today. There seems to be general support for ensuring that no business model is excluded from a loan program like this, and there are opportunities to raise awareness of the worker ownership models that exist today. In closing, WORK applauds Supervisor Simidian and Ellenberg's leadership and supports this proposal. We are actively leading efforts to establish similar supports for worker-owned conversions in the upcoming legislative session at the state level, and action by the County of Santa Clara will only bolster the case for the state support in this area. Thanks very much for letting me speak today.
And Madam President, Supervisor Cortese is joining us now.
Great, thank you.
The next speaker is B. Beekman. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, thank you. I hope at this point in early November, we're all becoming clear with the idea there may be an expected rise in COVID-19 cases throughout the winter, and that we are going to have to work hard so that the previous 70 deaths a week across the Bay Area may only grow to a minimum amount of 100 to 120 a week this fall and winter. For all of our efforts and worry at this time, this means to please continue to use caution and safe practices all through the fall and early winter. And as I hope we are headed towards a lame duck presidency at this time, a reminder that the current president just fired a very decent-minded defense secretary. I think it really needs to be noted by local government bureaucracies at this time that fairly large catastrophic events locally, nationally, and internationally of the past 20 years often take place within the early transition and change of a presidential administration. Thanks for your time. These are my efforts to consider, our future bureaucratic practices and how we can prepare ourselves. And so thanks a lot for your time in this meeting today.
The next speaker is Deborah Spolsky. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, Board of Supervisors. I really appreciate you hearing me today. My name is Deborah Spolsky, and I work at the Office of the Assessor. I work in the Ownership Identification Department, and I live in District 4. My work is essential for our community, and as I mentioned in my letter today, I'm helping an elderly mother transfer her childhood house to her daughter. I provide a service to grieving widows and widowers, grieving children, frightened people that worry about their taxes and their homes and their ownership and how it affects them every day during COVID. It is a compassionate, essential work, and it's more important today more than ever. We must avoid any harm that this proposed budget will have on communities and residents who rely upon our services, and to the SEIU 521 workforces, which are primarily low wage already, like me. We cannot balance the budget on frontline workers again. I'm also a disaster worker, as many of you know me and see me every day. We must learn from the actions taken from the last recession. Please delay the vote on the budget until next year. I have faith we will have a new White House administration in July 2021, and we must work together, delaying any cuts that could be mitigated with new federal funding stimulus that could save our services. I thank you for your attention and your kindness.
The next speaker is Dave Longcore. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon, Board of Supervisors. My name is Dave Longcore. I'm an electronic repair tech at the VMC Facilities Department. My work is essential for our community and the VMC Hospital campus. Testing and performing preventive maintenance tasks on the building fire alarm safety notification and control panels and the associated interface devices that report to the fire panel. It is very alarming that the public and the board were not supplied this planned budget until 4 days ago. I implore you to delay this decision until the new year. A turnaround with less than 2 weeks is incomprehensible and cannot be afforded to the impact of the lives of my coworkers and the lasting complications on the communities we provide service to. We must think of all the alternatives to the reductions to these vital services for our communities and the SEI 521 employees, frontline essential workers who provide them. Thank you.
The next speaker is Melissa Willett. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, good morning. Good afternoon. My name is Melissa Willett. I work at the Office of the Assessor, and the frontline staff in the Office of the Assessor performs essential work for our community. The county has already indicated its commitment to racial equity, and the COVID-19 pandemic has only exacerbated longstanding inequities in our community. The county must take this budget seriously and prioritize deepening its commitment to advancing racial equity in this budget and policy decisions. It's very concerning that the public and community stakeholders were not provided the proposed budget until just a couple days ago. And in less than 10 working days, this board will be rushing a decision that's going to considerably impact the lives of workers and the community. Our community's pre-pandemic problems are still there, and those suffering the most from COVID-19 and its consequences are the same individuals, families, and communities that were already suffering, that were already seeking county services. Our overarching budget priority is that the county protects safety net services that meet the critical needs of those who have been systemically disadvantaged and harmed. We must also address inequity through full and equitable funding of services to ensure enough resources for all services that are essential to those communities, and through fair and adequate compensation of essential workers whose ethnic diversity parallels that of the communities we serve. Please redirect funding to address systemic racism and provide services and community development support for Black and Brown communities. I urge you to delay the vote on the budget to next year. We will have a new White House administration in January 2021, and we would have to work together in delaying any cuts because we know that there are solutions to be found. Please give us the time to find those solutions. Thank you.
This concludes the public speakers.
Thank you very much. We're now going to go to our board agenda to item 4. And item 4 will be the county exec's review of the recommended budget and giving us some background. What I wanted to ask, just to clarify for the public, Dr. Smith, as part of your overview, if you could talk a little bit about the process and how the process unfolds over the next couple of weeks as well. Thank you.
Sure, I will. Let me share my screen. I've got a very short presentation.
Madam Chair?
Yes.
I'm sorry, I tried to do the electronic blue hand. I couldn't get there. Just if I may ask a quick question of you through the staff.
Yeah.
Thank you very much. I know the talks about the federal stimulus. I just wanted confirmation. All of our budget people feel the federal stimulus would not be ongoing funds. They would be one time only. Is that correct?
As far as we understand, of course, the new stimulus hasn't been approved yet, so it would be extraordinarily unusual for federal stimulus funds to be ongoing.
Thank you. Thank you, Madam Chair. I just tried to get that in before we got to the next item.
Oh, all right. Well, this is actually no next item. It's our first item. So, all right. So go ahead, Dr. Smith, take it away.
Okay, thank you, Madam President, members of the board. As I mentioned, Greg, our budget director, will be giving you a much more detailed presentation, but I felt it was important because of some confusion about this year's process to just go through some basics. For the board, this will seem like budget tutorial 101, but I think it's clear that many members of the public and employees who, have been busy doing their own work and dealing with COVID and dealing with a million other things, haven't necessarily gotten the full picture of what's going on in the county budget this year. So if you'll indulge me, I just try to go through some of it fairly quickly. I have 8 slides and then I'll turn it over to Greg. So this year was a very strange year, and back in the fall, you heard us say that our estimated deficit for the general fund was somewhere between $300 and $600 million. Now, this is unusual because typically we would have a much more definitive number. So I'd like to go through why we're here and how we got here and how we plan to get out. Now, I want to have one caveat at the very beginning. This deficit was partially because of COVID, but primarily because of a lot of other factors going on. You'll remember 2 years ago, we talked about a budget deficit that was upcoming and a recession that was upcoming. And back in the fall of 2018, before COVID was even a reality. We talked about a budget deficit and a recession coming. So I don't want anybody to get the impression that this is just because of COVID. COVID contributes, but not exclusively. So first of all, a little bit about the documents that people can find online and on the agenda today. We have two major financial processes that we go through in the county every year. One is the budget process listed on the left, which is a forward-looking policy process, which is based on projections for the next year, for spending for the next year. And one on the right is the comprehensive annual financial report, which is a retrospective scope looking at what happened last year, how we spent money, where we are in the current year. First, to go through the budget process back to the left side. During the fall and early winter, we develop what is called the current modified budget, which is the previous year's budget with changes that are typical throughout normal year, from actions that the board takes every other Tuesday, as well as changes in revenue, changes in overtime usage, changes in staffing, changes in need. Once we've developed that CMB, we then go to develop this current level budget, which some people call the base budget, which is the fundamental building block for next year's budget. This CLB reflects changes that are related to costs that we can project in the future that we know will be there, such as personnel costs, debt costs, a number of other costs. Typically in the CMB, we have projections for our enterprise fund, which are based on what we think will happen in the future, because revenue from the federal and state sources comes late in the process. The CLB tries to take that into account also, because the CLB is the building block for the upcoming year. The CMB is straightening out the budget for last year. After we have the CLB and have some idea of what that means, if there's a deficit projection, we come up with an episode, or we ask the departments to come up with targets for reductions. And we work with the departments rigorously in order to come up with ways to meet those targets. The county executive does not accept all of those targets and oftentimes changes them, and that ends up giving us the county exec's recommended budget. Now, for this particular episode we're dealing with in November, you received off agenda a large packet of material from the departments which reflected department targets. We did not incorporate many of those into the county executive's recommendations that are before you today and that hopefully you will act on at the end of November. So those off agenda reports from the departments were given to the board and are available to the public as off agenda documents merely for reference and information. The only thing that's being considered today and throughout the month of November is what's in the budget recommendations from the county executive budget before you. In a normal year, after the county executive's budget is modified in June, the board adopts a final budget, which happens before July 1st. In this year, that process was put off until August. We'll talk about that in a little bit of detail later. I really want to emphasize on the right-hand side of the page that the comprehensive annual financial report is not part of the budget, should not be utilized to be thought of as part of the budget. It's an audited examination of the actual expenditures and revenue from the year prior. It shows the county's net position, or what some people would call the net worth. It also shows balance sheets that are developed based on the expenditures and revenues from the prior year. And the balances that are listed in the CAFR are already resources that are allocated by the previous year's budgets. They cannot be used in the going forward year as a source of revenue because they're not new revenue and they're already accounted for. Now, usually developing a recommended budget is a relatively predictable process. This year it was not. On the left side, we have our typical primary revenue sources. And these are local sources, which include federal or property tax, sales tax, and fees. Of those three, property tax is by far the largest. Sales tax used to be very small, but because of Measure A, it amounts to a significant amount of money at this point. Fees are very small. The second large source of revenue is state subventions. This is money that we receive from the state in various different types of funds and always attached with some regulation or some project or some component of service. For example, we receive money for Medi-Cal services from the state and the feds at the hospital. We also received monies related to particular programs in social services. State subventions are a significant but relatively smaller source of funds than property tax. Then we have federal subventions, which are similar to state subventions, but typically different programs. On the right-hand side, we have expenditures in general categories, very high level. If you want all the details, you can look through the recommended or approved budget online. But since this is designed to be high level, I only included the four that are typically looked at. One is personnel costs, which we call Object 1 costs. One is service and supplies, which is called Object 2 costs, which includes contracts and contracts for services. Then there's debt repayment and reserves that are allocated. Typically, as I said, revenues are harder to predict than expenditures because we know how many people work for us, we know what our contract needs are, we know what our debt is, we know we have requirements for reserves. We can typically predict that pretty well. This year, neither one was predictable very well. Let's start with the expenditures and explain why this year it was less clear than normal. Regarding this modified budget and the level budget, as I mentioned, the modified budget has to do with really truing up the previous year so we know where we're starting. And the true up this year was challenging because ACA and other regulatory changes from the state and the feds meant that predicting what revenue would be available by the end of the fiscal year was difficult, even though we had incurred the expenditure or the costs already. Also, there were many new initiatives this year at the state level. PCR was one of them, which eliminated group homes from the social services care network and created the requirement to provide wraparound services in smaller homes. This initiative that came from the state was very challenging to institute and very inconsistently instituted in conjunction with our community-based partners because there simply weren't resources to provide them. So trying to guess how much that was going to cost or had cost was challenging. There's also more overtime, and we had new MOUs that for the most part were developed in the spring, and trying to come up with reliable cost estimates was hard. Also, the recommended budget was challenging this year because we had crisis costs which started in the January time period related to COVID, fires, and numerous other crises that were unable to predict the cost of prevention or treatment. Another thing that was challenging for the recommended budget was new and local and state initiatives that would take place or take effect in the future. And then there's always the question of how much do we backfill services that are defunded. So expenditure predictions were hard. Revenue predictions were even more difficult than they typically are because with property tax, the governor instituted a fee and time waiver for the payment of property tax. This is extremely atypical and meant that one of our most reliable sources of revenue and most predictable sources of revenue was no longer predictable or reliable. In addition to that, another form of property tax is excess ERAF, and there was much change in the budget, state budget, related to taking away excess ERAF from the county. Still has not been resolved. Also, we've had large assessment appeals, which also change our revenue projections. And up until just last week, Prop 15 was another variable that was hard to predict in terms of what it would do to our revenues and expenditures. From the state level, a $54 billion deficit for this fiscal year, which was over a third of the state budget, had uncertain cuts associated with it, making the future revenues for fiscal year 2021 very challenging to predict. And then federal risks that also made for difficult predictions for 2021 included changes in ACA, whether or not we would get the CARES Act funding, changes in SSA, and a $1 trillion+ giveaway of federal taxes, which funded many of the programs that we rely upon. So all of that being said, we had a situation in the fall where we had predicted deficits that were had a wide range, like we said before, between $300, $600 million of projected deficit for the next year, the 2021 year, which started in July. At that point, we made a recommendation to the board, which the board accepted wisely, that we do our budget balancing process this year in an incremental way because of the structural and cyclical deficits that existed and because of their unpredictability at that time. So this describes what's the difference between a structural and a cyclical budget deficit. For us right now in this year, 2021, both are happening at the same time. That's not necessarily always true, but because they're both happening at the same time, it makes predictability much more difficult. You can see that a structural deficit really has mostly to do with what happens at the state and the federal level, where actions that they take trickle down to us and cause dramatic swings in our revenue and therefore dramatic swings in our ability to provide services. And structured deficits can happen at any time depending on what the state, the feds, and the national economy do. Really, the only response that we can have at the local level to structural deficits is either to raise taxes or cut expenditures. There's not much local control we have over structural deficits. Cyclical deficits, on the other hand, are related more to the economy and the normal cycles of the economy. In California, counties have a typical 10-year cycle. Our last major recession that we needed to deal with was in the 2008, 2009, 2010 range. And now, we're 10 years later and we're dealing with another downturn. It has to do with slower growth and therefore slower smaller taxes that we receive, and as part of the normal cycle. Typically, it's not huge numbers, although in 2008 it was a huge deficit. And it's usually something that we can deal with reasonably on our own, but this year it's duplicated or increased in severity because of the structural deficit. All of this means that we can expect a K-type economy, which will make the county's life and budget and service levels much more difficult to maintain. K-type recovery means that the rich get richer, the poor get poorer. We can see that around us right now. Stock market is going up, property values stay up, taxes on the federal level and state level go down. Those who have money have capacity to move their money around. Those in selected industries can survive risk well. That is the arm of the K-type recovery that goes up. The arm that goes down is that the poor get poorer and the middle class get closer to poor. There's less opportunity on Main Street, more poverty, more homelessness, less support from social services and other services, meaning that as the population increases, we have many more needs and many fewer resources to provide those needs. As we all know, in the nation, 65 billionaires are worth more than 165 million other citizens. There's only 330 rough million citizens in the entire nation. So virtually half of the nation is poorer than 65 people. That's a big problem. The disparity of wealth will hit the county very severely because we're responsible for providing the safety net services that keep the fabric of society together. Without the resources that are now being enjoyed from the upper echelon individuals, we cannot provide for the lower group that needs their services. So far in 2020 to 2021 fiscal year, we've taken this incremental approach, both designed to give us more time to make decisions and also more time to be clear about revenues and expenditures. In June, we balanced the budget mostly with one-time funds. In August, we focused on the criminal justice vacant positions because we knew there were smaller censuses in the jail and juvenile hall. We knew that criminal courts were less busy. We knew that our efforts to prevent entry into the criminal justice system were more effective than we had hoped, and we're very happy about that. And we knew that criminal justice reform was coming. So this was a clear area where we knew that reductions were necessary, and we focused on vacant positions to avoid hurting individual employees. Now in November, after we've had more time for consideration, we're making more strategic recommendations that will result in savings. These savings will be partially for this fiscal year, but primarily focused on next fiscal year. The savings that we're recommending to you today and that you will discuss for the rest of the month are focused on reorganizations, which are basically the assessors department, TSS, and social services. These reorganizations are efforts which will make the departments more streamlined and more able to deal with the needs and the expenditures in the future that are required. Another area of focus is the elimination of more vacant positions, again, to try to avoid as many layoffs as possible. And those vacant positions come from a number of areas in the county. There will be some reductions in departments that have grown rapidly over the years, and those reductions are euphemistically called reductions or eliminations of vacant positions, but in truth are in part layoffs. We know that this is an extremely difficult decision to make, and out of the 160 so positions that we're asking you to consider eliminating, about 30 of them are positions that would be anticipated to be full in March. Any layoffs that are approved at the end of November will not take effect until March, so that will give incumbents in those positions the opportunity to either participate in our voluntary separation program or to participate in our in-placement programs, allowing them to move to other vacant positions in the county. And then we are planning for our voluntary separation process, which has already started, requires no specific new action from the board, either today or by end of November. It's available to our employees who wish to separate from the county voluntarily with an incentive, separation incentive. They just have to notify us by December 1st and have to be willing to separate by the first pay period in March. So with that, I'll open it up for any questions in general before I turn it over to Greg to go through the details.
Dr. Smith and colleagues, I want to make 2 requests before we do that. Request number 1 is that that this presentation be posted to our agenda, and because I think, Dr. Smith, this is something that hasn't been posted yet. Am I correct?
Yeah, you're correct, because I was working on it late into the night.
Yeah, no problem. I just wanted to make sure people had access to it, and I didn't have it in my packet either, so I just want to make sure the public has access. So if you could forward that to the clerk so the clerk can post it, would be really helpful. The second thing is that I would just say this to my colleagues, that the presentation we have in our packet covers a little bit of this ground, and what I'm wondering is if it's appropriate, if we could take the introduction comments from Greg and then open it up for questions and comments before we go department by department. Is that all right? All right. So Dr. Smith, we'll go to Greg, and then for his introduction remarks before we go department by department, and then we'll come back to the board for comments or questions.
Okay, Greg, you're on.
All right, President Chavez, members of the board, this is Greg Etruria, County Budget Director. I believe I'm sharing my PowerPoint. Can I get a confirmation? Very good. You are. Okay.
Thank you.
Okay, thank you. Yeah, so just to continue with the overall context that was teed up by Dr. Smith, I'd like to provide to the board, let's see, There we go. Some additional, high-level presentation before we jump into the specific cost reduction recommendations from the county executive. Just to reiterate, the board adopted a balanced budget on August 21st. That balanced budget where the authorization for expenditures, what we call appropriations, is equal to the available resources, primarily estimated revenues, the fund balances, as Dr. Smith mentioned, and a heavy reliance on one-time funds to balance that budget to provide some flexibility and time for administration to return to the board with additional ongoing cost reduction recommendations as contained in your packet and as we'll discuss in this workshop. We also want to provide an update on revenue estimates and overall fiscal condition, since for noting anything that has changed or has not changed since our broad presentation to the board in August. And happy to report there are some slightly improved general fund revenue estimates. That plus the additional cost reductions recommended by the county executive can provide some modest improvement to our overall financial condition. Board members will recognize this slide format. This is the format we presented to the board last spring, describing the nature of the structural deficit, showing that our ongoing costs and our ongoing revenue projections have this gap. We provided an update, if you recall, in August as well, that showed that that gap had improved a little bit. And here again, we want to show that that gap is improving modestly with the cost reduction considerations and revenue updates that we will be describing. While we talk about that structural deficit being somewhere around 300 million or so, often we like to prefer to talk about it in a range because of these very large variables. The variables are still largely remain. Dr. Smith spent a lot of time on that, so I don't want to dive into that too deep, but you'll recognize this display as well. We are tracking that, and we do want to recognize that as we get improvements, in this case from further cost reductions under consideration, improved general fund revenue forecast, we can show that even that range can improve over time. New information since August. A couple things to report actually is where we were hoping to have new good information and we don't yet. First, the federal government has not yet passed additional funding for our pandemic response or any kind of a stimulus funding. And we were certainly hoping that it would happen by this meeting. Further, as we mentioned in August, we still do not know ultimately how the state controller is going to direct the allocation of education revenue augmentation funds between local taxing entities and what the county share will be. They have until the end of December to provide that, and then our finance agency will allocate accordingly, of course. So that's still an unknown. However, there is some good news, though. There was an outstanding court case down in San Diego County that was resolved in the favor of counties. And as a result, we will have some improved reallocation of property taxes that benefits counties. And for us, that will be about 11 million per year ongoing. And they're going to retroactively apply that for a couple of years. So we will get a one-time funding that will this year as well. And then also there's continued progress on the liquidation of RDA assets. And we're estimating that will also lead to an additional 3 million ongoing based on some of the remaining asset liquidations from the RDAs. Again, good news. Regarding the overall pandemic response and CARES Act, as we've mentioned, we're still waiting for additional funding from Congress. We are anticipating that by the end of this fiscal year, based on our current expenditure for pandemic response, for testing, for tracing, for outreach, that we're on pace to spend about 245 million more on pandemic response than what we've received from the federal and state so far. So we'll continue to advocate strongly, encourage all to join us in advocating strongly for Congress to allocate additional pandemic response funding to cover these costs that we're incurring. This 245 is a projection, and obviously projecting costs and revenues challenging for all the reasons the county executive mentioned earlier. But even these just particular are challenging related to the pandemic response. If there's an additional surge, if there's a heightened level of mitigation efforts that are needed, of course, those estimates will be impacted. We'll continue to come back and update these projections when we get more information and trends become more clear. Also related and important is our Valley Medical Center hospitals and clinics financial condition. As we described this last summer, our patient volume was down, and because of the pandemic conditions, right now we're not projecting for the patient volume to fully return until 2022. And even then, at this point, we believe there will be a different payer mix that will be slightly different even once we get back to normal, where their current funding sources may not fully cover all of our costs with that mix. So there's continued uncertainty surrounding these revenues, and a concern about our current budget for the hospital and clinic system based on this patient count. And, as we described this summer, there was an operating deficit. We had to rely on one-time funding to help deal with that. And we still have concerns about how we're going to address that, of course. While we have received $120 million so far in COVID relief for public hospitals, we've been able to apply towards some of that lost revenue. More is needed, and we'll continue to advocate for more relief for public hospitals as well. Back to some good news. One of the threats we described this summer was that the federal CMS had a proposal on the Medicaid fiscal accountability rule, which was going to take away $25 billion to hospitals for Medicaid funding. That would have had a very negative impact clearly on us. And good news is they've rescinded that proposal, so that part of our revenue projection is still good. Also, a concern we described this summer was the threat of whole person care funding not being renewed. We had budgeted as if we were, the $25 million as if we are going to get it. Well, it hasn't been confirmed yet. It is looking more likely now that we are going to get that $25 million, either directly as whole person care or an equivalent replacement. So that's good news. But even with this good news, just to reiterate, the hospital is fully challenged to meet its financial goals for this year, giving all these challenges, giving the commitment of resources in the pandemic response. And just we acknowledge that the system may need an additional infusion of subsidies sometime this fiscal year, even as it's taking these aggressive actions to control costs. Upcoming steps. So throughout this afternoon, I'll be walking through the particular recommended cost reduction actions from the county executive today and tomorrow. Later tomorrow, there'll be an opportunity, of course, with the workshop to discuss the other items board members have asked for a conversation about as well. We'll have that. We intend to come back on November 18th to ask the board to make decisions on these recommendations for reducing our ongoing costs. And then based on whatever the decisions are made by the board on the 18th, we plan to come back 2 days later on the 20th with an amendment to the salary ordinance to carry out those decisions that are made by the board on the 18th. Then after that, we plan to return back to our normal calendar and schedule for the budget prep process and preparation of developing a balanced budget for next fiscal year. We'll kind of kick that off with a comprehensive mid-year budget review in February. Like we've done in the past, we're looking at the first full the first regular board meeting in February for that. We will have included in that some additional budget reductions, and we're working on negotiating service contract to reduce cost as well. We're intending to have those recommended amendments brought back to the board with mid-year. And then throughout the spring, we'll be working on a balanced county executive recommended budget, publishing it back on a regular time of May 1st. Again, back to regular budget workshop in mid-May and budget hearing in mid-June for the fiscal year 21-22 county budget. Throughout this process so far, where possible, the recommended cost reductions that have been initially developed by county departments and reviewed by the county executive, considered racial equity where it could. But this is a new process. We expect this effort to grow significantly over the next couple of years, aided by formal training that departments will be undergoing this winter in preparation for the development of next fiscal year's recommended budget proposal. And with that, perhaps President Chavez, this might be a good time to pause before we go into the various agency and department specific county executive cost reductions in case there are any questions the board may have for us.
You're on mute, Cindy.
Thank you so much, Susan. We will pause here because this will complete item 4 before we go to item 5. So for item 4, we'll go to public comment and then back to my colleagues and then to the next item. So public comment.
Next speaker is B. Beekman. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
All right, thank you for allowing public comment on this item after Dr. Jeff Smith. The mayor of San Jose has recently stated we are headed towards a possible foreclosure problem, and there may be a new upcoming recession process all by this time next year. Supervisor Wasserman was offered today federal COVID-19 funding seems to be a one-time deal at this point. I think we have to ask and even demand the most recent federal aid package approved immediately before the election can have a companion bookend. And perhaps most importantly, from previous CARES and HEROES Act funding, the state of California has been building financing and funding systems to prepare for recession, foreclosure, and housing needs predicted and also planned for 2021 and beyond. We need to be open to funding help that can be offered from the state level. We need to work for and demand continuing CARES packages from the federal level. Most people should not be blamed for a select few that helped create and usher in this international pandemic. Even as we may be able to wind down the pandemic in the next few years, we're going to still be in extraordinary circumstances for the next few years. A thank you for the many who have tried for our lives to be mostly the same during this time. For as much as we want to maintain the same business and economic practices, please be open to consider what larger state funding programs can help with for the next few years. Thank you.
This concludes the public speakers.
Thank you. I'm now going to go to my colleagues and see if there are any blue hands or questions or comments. I'll go to Supervisor Ellenberg, who's leaning in. Not a blue hand, but a lean in.
Leaning in, looking for the blue hand, looking for everything. Thank you. Thanks for that initial overview. I have a few general questions. First, to Dr. Smith, just regarding the budget process at large. This past year, we took steps to incorporate board priorities into the budget process, and I want to particularly thank Supervisor Chavez for leading us on that and making space for it. It is important to me that we continue those efforts. And in that vein, I'd like to ask administration to report back at next week's budget hearing with options for how the supervisors can communicate our priorities either individually or as a group for fiscal year 2021, 2022, so the board priorities can be included in the January 5th budget instructions to departments.
Surely, we can do that.
Great, thank you. And then going ahead, that should be a regular fall piece in November, looking toward the next fiscal year. With regard to COVID, Dr. Smith, your memo references additional information on COVID revenues and expenditures that are expected to be forthcoming. Can you give us an estimate of when we might expect that information to be provided, and just generally how the expenditures are lining up with the projections that we reviewed during the August budget hearing?
We're dependent upon the federal government, the legislature, and the president to decide when we will get supplemental funding. Right now, as I think was explained, our projected expenditures are over $250 million and counting, because the response is obviously not open or over, and we've only received about 135 million. So we're hopeful that there will be rapid action, but I think it's pretty clear that there won't be any action until January. And on top of that, since you asked, we're very concerned because yesterday our new case numbers were in the 306 range in one day, and today they were 360 range, sorry. And today they were in the 260 range, which is far higher than they have been 2 weeks ago, which is very indicative of the fact that another spike is coming, which will be very challenging to deal with and will obviously increase our projected costs considerably over the 250 million, probably, I'm just guessing here, into the near 300 million at least. So COVID is not getting better and is going to cost a lot more. And obviously we're gonna do it because it's our critical mission to protect our citizens and your constituents. And so we're gonna do everything we can to keep as many people safe and healthy as possible.
Thank you. I just want to put a little fine point on that overall, COVID is definitely getting better, or being much better addressed, I should say, in our county, between the protocols that we have put in place, the largely compliant nature of our community, and what we understand about the virus now, I think has enabled us to keep our counts relatively low compared with other counties and other states. I see the spike coming too, and it particularly worries me as we move into cold weather and holiday season. And I think that's something that outside of budget, we need to talk about messaging really aggressively on. But I'm going to come back to the comments that I have here. In response to referrals by Supervisors Chavez and Cortese, the county's work with CBO partners on COVID outreach, especially in our most heavily impacted neighborhoods, has been essential in bringing down case rates and reducing disparities. So I want to take this opportunity to weigh in to say that I think that it's extremely important that we continue these partnerships. The work is far from done. You just made that case eloquently. And a sustained partnership, I think, will be extremely useful to the county in continuing to build community trust, sustaining an infrastructure for dissemination of information across a range of subjects, ranging from public health issues to service accessibility to opportunities for greater economic stability. I believe that the Chibet and the enhanced communication efforts were contracted with the CBOs just through the end of this year. with a plan to then reevaluate needs. Can you tell me what plans may already be in place to extend or adjust these programs into the coming year?
We anticipate that we'll be extending the contracts into the next year and probably far beyond that. I can tell you that we hope to be as efficient as possible with operations, and we value the CBO's contribution greatly, and it's always going to be a balance of where the services are and how they're provided and how much they cost. But just like the board, obviously administration is committed to make sure that we work with our partners and make sure that the work gets done.
Great, thank you. So since they end in December and we're already in November, I trust that that means that someone will be reaching out to them in the next week or two to talk about extension periods and terms.
Yes, we have a delegation of authority from the board through the EOC process, so we do not need to come back to the board for further extensions. We'll obviously report to the board and make sure the board's aware of what's going on, but we will reach out to them in the next week or two and make sure that we continue the contracts.
Great, thank you. We've also discussed the commitment of resources, including funding by some of our city partners to the isolation support program. That also just goes through December. What plans do we have for continuing support of residents that test positive or their close contacts beyond the end of this year?
Pretty much the same answer. Housing is going to be working with those partners to get those contracts extended. As we have all talked about in the past, where housing is strained at this point, and we're trying to find new resources internal to the county in order to provide them with more help. The home key issue caused a lot of distraction, and so did a lot of other things, particularly houselessness and the like. So we'll be extending those contracts with the cities.
Great, thank you. And just some general comments about balancing the demands on county departments. While the proposals that we've looked at are largely planned around individual department targets, some across the board, contract analysis is planned for mid-year, which I'm appreciative of, and want to share that at HHC, Supervisor Simidian had raised concerns about the long-term strain of the public health department to continue to respond to COVID, as well as to address other critical health issues in this environment of constrained resources and high vacancy rates. The challenge of balancing COVID responses with other urgent county needs obviously impacts the entire organization, but I don't know that we have had a robust discussion of where we may need to shift staff or effort to boost some of these activities while delaying or pausing others. So just like with the proposals to add or delete positions, I think we need to be very transparent in our priorities of where work occurs across the organization and what we choose to do and not to do in this current environment with board direction and public input in that discussion. Can you speak to that, Dr. Smith, about how an overall balancing of effort across the organization as a whole is being assessed and prioritized, or should be / will be?
Yes, I can speak to that. We're obviously looking to see what the board tells us here in November about basically going forward expenditures in next year's fiscal situation. We're also looking at the response to the voluntary separation plan and revenue projections that might come before February, but our plan is to address those specific issues that you're talking about during the February mid-year. So I think the board can reasonably expect that we'll come back in February asking for more resources to go to public health and some of the other agencies that have been at the forefront of responding to the COVID response. Also, each one of the departments has their continuity of operations plan in place, and they're all looking at it carefully to assess what might be needed going forward to maintain regular operations. And we clearly are working on board initiatives such as the loan program and other specific initiatives. So we will be coming back in February with all of that on the mid-year revision.
Great, thank you. I appreciate that. I think that is all I have on the overview section. Thanks very much again for your answers, Dr. Smith.
Thank you. I'm going to see if there are any other colleagues who want to ask questions of the overview. I see no hands or no leaning in. So, okay, Mike.
Thank you, Madam President. Through you to Greg, if I may. Greg, do you have any indication at all what the federal and state, what the federal government and California's government is projecting as far as the deficit? 2, 3, 4, 5, 6%? Any number at all being thrown out?
There's not a number that's being thrown out, but I did notice that while the state budget had projected a $50+ billion deficit for this fiscal year, they also used a lot of one-time solutions to balance the state budget. And so myself and my colleagues in other counties are all looking forward to seeing what the governor's going to propose in January to do with the state budget. And because so much of our funding is depending on state allocations and subventions, we expect that we'll have to make some adjustments to whatever the state is going to be doing there.
Greg, that's why I was asking. To me, it's really a leading indicator. If the federal and state government cut their budgets 5% and 7/8 of our budget comes from the federal and state governments, it's a natural assumption to assume a trickle down from the federal and state government to us. And I just want to make sure that we're charting that, following, tracking, whatever you want to say at any given time. Because if they go from a 1% cut to a 6% cut, we can expect some sort of repercussions, trickle down effect from them doing that. That would be number one point. My number 2 point is, given all the uncertainty in the world, and Jeff Smith talked about it, the stock market hit an all-time high today. High-tech companies are thriving today. That K graph, there's those that are thriving, and there are those that are suffering and starving. And the county's role is to help those people most in need. And quite frankly, I'll say to all administration and my fellow supervisors, we're going to be treading water probably for about 6 months is my hope. My hope is that another stimulus comes along within 30 days. My hope is that a vaccine starts to be distributed within the next 60 days. So I'm looking for things turning around in 6 months. But until then, if our administration, if our 22,000 employees can simply maintain the status quo with fewer people and greater need, they'll all be heroes. And I think that's what our goal should be, is to have that balanced budget that Dr. Smith and Greg are getting us through. But the need is greater than ever before while the revenue is declining. So if we can stay above water, maintain the status quo, whatever expression you want to use, during the next 6 months, we'll have done our job. Thank you, Madam President.
Thank you. I'm going to go to Supervisor Simitian.
No comments or questions at this time. Thank you, Madam Chair.
Oh, I'm sorry. Thank you. Dr. Smith, you wanted to respond?
Well, I just wanted to augment the answer to Supervisor Wassman's question about the state. One of the things I'm very afraid of is, as Greg pointed out, much of the solution to the state's budget deficit was accomplished with one-time funding, and also these trigger cuts, which involved cuts that were supposed to be automatic to the budget if the feds didn't produce money by October. That legislature didn't actually adopt that, so the triggers weren't pulled. But I'm very concerned that the triggers would have included many cuts to schools. And I think it's highly unlikely the legislature and the governor will be anxious to see any more cuts to schools. So if they don't cut schools, they will have to cut us. So not saying I want them to cut schools. Actually, what I want is money from the feds. But I think we need to be aware that there's a likelihood or a possibility that soon the state will change its position on the trigger cuts and come back at us.
Thank you. Supervisor Cortese, did you want to weigh in?
Nothing at this time. Thank you.
Thank you. For the overview, I do have a few requests. And one is that as the board presentations come forward, I would be very interested in having the presentations of the description of the equity tool, the source of the tool that's being used to put an equity framework on the departments that can do that to date. Dr. Smith, is that something that the staff can do as they make their presentations?
Greg's going to be doing the presentation with questions and answers available to the department heads available for questions and answers. We will try to give you the best we can. As Greg pointed out, the tool is not mature at this point, but with the greatest extent possible, we'll give you the best answers we can.
So in the reading material, it said that some departments used an equity tool because they'd already been trained. And really, what I'm asking for is those departments that already did it, if they could give comment about how the equity tool impacted the recommendations and then the final decision that you all made.
Sure.
Thank you. Second is that on pages 4 and 5, the assumptions are very broad. And I do want to say to the staff, I really appreciate very much using a range. What I would like to receive before we take a final vote on this budget are the key assumptions that are included in as detailed an analysis as possible to help us understand the bandwidth of those risks before our final budget. And then the other thing that I wanted to raise, Dr. Smith, is a little bit on the front that Supervisor Ellenberg was looking at relative to the operations that essentially which is the EOC versus the overall approach to the budget. And in particular, I think the point that was raised about the key bodies of work that will be extended, again, off agenda, just to better understand what that is and what those investments are, particularly as they relate to the outreach programming we're doing throughout the community, I think would be helpful, more so that we can publicize it so the nonprofits aren't confused about what they're being funded for and what's part of the emergency response versus, the other items that the board will be considering.
Surely.
Dr. Smith, is that something that makes sense to come through budget or as part of one of the COVID report outs at a board meeting?
Probably makes more sense during the COVID report out, but we can do both that and an off agenda.
Yeah, what I would suggest is maybe if it's possible for next week, just to incorporate it into what that, because just to the overall presentation, that might actually help. So people aren't waiting for the last minute.
Sorry, it wasn't working. Yes, we'll do it.
Thanks. All right. And then just for my colleagues, what we'll do, and just for anybody who's listening, I'd like to take each item, item 5, and then have board input and conversations and discussions, see if there's any have the staff present on item 5, then go see if there's any comments from the public, then go to the board. Same with 6 and 7, just to keep them. There's enough moving pieces here that I think it might be better to do it that way. So I'll now go then from item 4 to item 5. And Dr. Smith, am I turning this back over to Greg?
Yes, Greg will take it back and go forward from here.
Thank you.
Okay, thank you, President Chavez. Hopefully everyone still sees my PowerPoint with the Social Service Agency header. Is that right?
No, we need it back.
Need it back. All right. Let me see if I can do this right.
There you go.
Thank you.
Okay, thank you. So what I'll plan on doing is go through each of these county executive recommended cost reductions for by agency, as President Chavez requested. I'll go through one office at a time, and then I do have a slide in there that'll be a nice prompt for us to stop for that public input and any questions. So let's get started with the agency office over at our social services agency. The agency office is kind of our overhead office and where we have some smaller programs embedded in it. The county executive's recommendation includes recommended action to delete 12 positions related to several programs as detailed in the report and here. Of these 12 positions, we believe that at least 7 of these will be vacant by March. And of course, possible to be more than that with the different efforts that the county executive described at his presentation earlier this afternoon. The service impacts for this recommendation, they do believe that there will be, some need to reorganize and to find, different ways to supervise and taking on duties, impacts to caseloads. But for several of the vacant positions here, the work's already been distributed among staff, so we don't think there's going to be an immediate impact on service. Of course, you can always talk about what would be the potential work that could get done if the positions were filled in the future. And then, the department also exercised racial equity conditions here and considerations here, and pointed out that just overall reduction to staffing in general does have an overall impact on the ability for the agency to use a racial equity lens in all their interactions. When we get to Q&A, we could also ask the agency director, department heads to get into more specifics about that as President Chavez requested. For the social service agencies, Department of Aging and Adult Services, the recommended action is to delete 6 positions And at least 5 of these positions we expect to be vacant by March. The total ongoing savings from these actions to the general fund is about $364,000. Service impacts, there is some concern about, really any reduction, even one, how does this affect the state goals and the agency's effort to achieve those state goals regarding reassessment compliance, concerns about longer, delays and work times, and some support efforts as well. And again, the deletion of the vacant positions, since that work's already been distributed, don't expect an immediate impact. Again, it's more about capacity for the future as well. And again, they shared with us a similar comment regarding the racial equity considerations, and just again, the more staff they have, the more they feel that they can be generally responsive. Regarding the Social Service Agency's Department of Family and Children Services, the county executive is recommending a reduction of 10 positions, all vacant positions within that department of the agency, in a variety of programs. Safety, well-being, dependency investigations, emergency response assessment, administrative support, as well as family support divisions. Service impacts for a variety of these programs. There's some concern about being able to provide backup coverage, but overall this work has already been distributed to remaining positions, and it's not expecting an immediate impact on service impacts. And one of the things the department did point out to us regarding the racial equity considerations is that reducing the staff could make it more difficult for their racial equity lens they want to exercise in all their interactions, and it's a common concern throughout the agency. Then regarding the Social Service Agency's Department of Employment and Benefit Services, the recommended action is to reduce 11 positions, all currently vacant, to achieve an ongoing savings of about $676,000 annually. No immediate impact on service levels, again, since these are vacant. There is some concern with the management analyst position. If we don't get that filled, that could have some 1 to 2 week impact on some of the employee service programs down the road. The other delays down the road, if the positions don't get filled, are also concerned with the intern and earn program, the eligibility examiner, whether that could have an impact on workload for the remaining eligibility workers in the CalFresh team as well. And with the DEB staff, and the racial equity considerations, they want to point out they think it could make it maybe even more difficult to help our population, which is already disproportionately impacted. And at that point, I think we'll pause here, as President Chavez, you requested, and see if there's public comment or questions from the board. And certainly we have the department's staff available here to speak to particular questions that the board may have.
Thank you. And I'll just say, if there's any members of the public who would like to speak to this item is relative to cuts in social services. And I'm going to just ask that the comments be focused on this department and focused on the discussion at hand. Dr. Smith, I'm going to ask, go ahead and have you weigh in, then I'm going to go to the public, and then I'll come back to the board.
I just wanted to point out to the board, for convenience, on the last page of the memo that's posted on your agenda under 4A is a summary of all the position changes. So if, as Greg is presenting, if you want to keep track of that, that has it all in one page, just in case that's useful.
Thanks, Jeff. We'll now go to the public comments.
The next speaker is B. Beekman. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, I hope my
Blair, you've muted yourself. So unmute yourself.
Hi, can you hear me now?
Yes.
I had a quick question of procedure. I would like to speak about very low income, extremely low and mixed income housing. Can that fall under social services?
Sure, go ahead.
Thank you, ma'am. Okay. I think it should be clear at this point, we need to expand the initial scope of AB 3088 and return to the good work of David Chu and Ash Carver this past summer on housing forgiveness ideas and state funding structures that very much address debt burden issues. I emphasize all are trying to survive this COVID-19 pandemic for the next few years. To state again, I hope we can all be open to the important state of California funding ideas and its financial systems that are currently being developed. I think it can bring a lot of relief to all sides of the housing issues and interestingly work towards community healing and solidarity for all sides as well. Good affordable housing ideas that can also simply address the new ideas of equity seems a really good fit and a good course for the next few years, and how California state funding packages and its hopefully growing financial systems can address recession and foreclosure issues into 2021 and beyond. The MTC has several housing programs. Some programs may want to make it a goal in the next few years how to unblock state bureaucracy and learn how to better work ideas of VLI, ELI, and mixed income ideas that have been developing at the local level for years now. Thank you for this item. I wanted to conclude, if I have enough time. Let me see how much time I have.
19 seconds.
I guess I'll stop here. Thank you for this item.
The next speaker is Sparky Harlan. I am unmuting you. Please accept the unmute and you'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, Sparky Harlan, CEO, Bill Wilson Center. Not quite sure if this fits right here, but I did want to thank the Board of Supervisors for the money you have put into the universal basic income for young people aging out of foster care. What I especially want to thank you about is how you included young people who had been in foster care but didn't legally age out, so they're often not eligible for all that support from the state, like THP Plus. And that has really helped a number of young people who have become homeless or on the edge of homelessness because they weren't eligible for those services. I see that Supervisor Chavez is looking at supporting additional youth who have been in foster care, not necessarily aging out. And I do think this is a fairly inexpensive way of saving those young people who had spent a lot of time in foster care but didn't age out at age 18. They might have been reunited with their family or kinship placement, but at age 18, they're suddenly homeless again. And this funding and your priority on this population has really helped a lot of these young people not slip into homelessness. So thank you for that support.
Thank you, Sparky.
This concludes the public speakers.
Thank you. Supervisors, any questions, or we move on to hospitals and clinics? Let's move on to VMC and clinics then, please. Dr. Smith. Dr. Smith?
Okay, here we go. It's going to get my screen shared. Yeah, thank you.
Good job.
Okay. Valley Medical Center, and the county executive's recommendation is to delete 48.5 full-time equivalent vacant positions across the hospital system and clinics. And this action deletes positions across all hospitals and systems, and particularly those classifications with a higher rate of vacancy and in consideration of the county's preserving the county's most clinical and direct service provisions, service providers. The service impact is since it's mostly vacant positions for over a year, there's not anticipated to be immediate impact. It more has an impact on future capacity that we'll need to keep in mind for the system. And at this point, because these positions have been a long time, there's not only not expected to be a service impact, but not really any adverse impact regarding our equity goals as well. The county executives also has a recommendation to help control pharmaceutical costs in the hospital and clinic system. It includes a recommended action to produce annually a little over 2.2 million in ongoing savings by evaluating, canceling a variety of contracts, improving inventory management of our higher cost pharmaceuticals, and by substituting similar pharmaceuticals. And as the hospital system always does, continuing to work to avoid any inefficiencies and any drug duplication in our inventory. At this point, the VMC has identified that this will provide these new opportunities for efficiency, reduce overall drug acquisition costs, and does not anticipate any adverse impact on insurance equity in serving our diverse patients. And then lastly, one other component, initially the hospital systems supplied this with their package. We wanted to pull it out separately because it focuses on expanding of capacity for our COVID-19 testing, is a recommendation to add a couple positions, reduce one to help offset that cost. But there is an ongoing cost of about 274 million, or at least annualized, for this cost to add a program manager and a nurse coordinator to help expand the county's community testing process or capacity for COVID. This will obviously help provide overall support and expansion, and the racial equity considerations, it should obviously, I think, be it's a positive impact to the entire community as we increase the access to these testing resources. And at this point, we can pause. If the board would like to ask for any public input, or if the board members have any questions of staff.
Madam Chair, I'd make a recommendation if I may.
Okay.
Thank you. He only has 3 slides left. And to do the last 3 slides, and then we'll hear from the public and then from the soups.
Yeah, the topics are kind of different, which is why I divided it up the way I did. And there are no public speakers on this item. So what I'd like to do is go to the board and then come back. But thanks, Mike. I know you're always looking for how to be more efficient. Thank you. Sure. I'm going to go to Supervisor Ellenberg.
Thank you so much. And thanks, Greg. Slide 8 in the presentation notes that an additional general fund subsidy to BMC may be needed this fiscal year. I don't think I heard what the main drivers of this deficit what the main drivers of the deficit are in the VMC Enterprise Fund.
Yeah, it might not have articulated it very well in the presentation. Thank you for the follow-up question. Yeah, there are, we're still having lower than usual patient revenues from, lower than usual patient services. We believe largely impacted by the pandemic and its impact on the entire system. So we do have lower revenues than we would in a normal year. That's creating a deficit situation. And there's been some of that was offset with some one-time funding from the federal government. We're concerned whether or not the federal government is going to be able to provide even more financial support to help close that gap. And then if they don't, then we'll have an issue to deal with out there in their enterprise funds. If the current revenues and subsidy don't equal what we have to spend to operate the system and respond to the pandemic. There's a gap there that if it continues to stay there, we'll have to come back to the board with solutions to discuss.
Okay, thank you. That helps a little bit. And on my mind all year have been still the transition of all of our employees from as a result of the purchase of St. Louis and O'Connor. And I want to just check whether any of the positions that are proposed for reduction here overlap with recruitments underway for unclassified employees that previously worked under Verity or anything else that might have a negative impact on their ability to continue in their unclassified positions as they move toward permanency?
Yeah, not to my knowledge, but we should have folks here from the hospital system that can probably attest to it more affirmatively than I can.
Great, thanks. Happy to hear from whoever has that knowledge, please.
And actually, if I might jump in, Supervisor Ellenberg, this is John Mills, Employee Services Agency Director. Yes, Greg is correct. There is not overlap between the vacant positions that are proposed for deletion and the vacant positions that are being held pending the unclassified employees that you reference completing the process for permanent appointments.
Good. I don't want any of them to have gotten through this whole process only to then find out that their position is no longer available for them. So thank you for confirming that on the record.
Thank you, Susan. Dave?
Just curious about what the explanation is on the couple of behavioral health positions that appear to be eliminated. Obviously, just in the context of increasing concern about mental health, particularly on the increase. I'm sure there's a backstory to why we'd be eliminating a couple of positions in that area, but I'm not clear what that is.
I think Sherry can answer that. Sherry, are you on? Maybe Paul?
We can come back to it later if no one's available right now. It's not critical at this moment. I just would like to get that information, get the explanation.
Supervisor President Chavez, Paul Lorenz. If I may briefly, the positions that we've identified which are vacant have been vacant for quite some time. So we don't anticipate any service impact based on our current situation, but we'll continue to monitor that.
Yeah, and I think the side I'd want to look at in terms of the continuing monitoring that just sort of might offset the thinking of the board is the continuing growth or continuing need side of it. Meaning they've been vacant for a long time. I would not dispute that assertion on your part. It's just that is there a higher propensity for them to be needed in the coming months, given the fallout from the pandemic and so forth, than maybe what we've seen in the past few years? So that would be my request that information come back with a little bit more analysis at some point. Thank you. That's all I had, President Chavez.
Thank you. Just a couple of overarching issues that I wanted to raise. And one is that when you come back with the assumptions on what our deficit is, one of them that I'd really like to understand is what we think the gap is going to be for the health and hospital system, also as a part of that assessment. And part of the reason I'm interested in that is that whatever new resources come out of federal level, it's clear to me that there are some that will be focused on health and hospital systems writ large, public and private. And I think, being able to share with the public what we've invested in health and safety here is a good thing. But I also think in terms of better understanding the reductions in the hospital coupled with the increased spending, that the I don't even like the term subsidy. I would like to say investment, but the subsidy / investment we make in the hospital, we anticipate will be from X to Y based on the following assumptions. Is that something that can be incorporated in that report back?
Yeah, we'll try to do that to the greatest extent we can. I agree with you. I don't like the word subsidy because if we organize the hospital in their general fund, it would just be like the DA's office. There wouldn't be a subsidy to the DA's office, or there isn't a subsidy.
Yeah.
The one issue that I think I should raise, which is related to your question, just I know you know this, Supervisor, but the lawsuit that's currently pending before the Supreme Court related to ACA, if the Supreme Court decides in a negative direction and throws out ACA, will have an enormous effect upon us. But of course, we won't be the only ones it has an enormous effect upon. So that's something we're watching very closely too.
Yeah, thank you for raising that. I think that's really important. And I would add it to that assessment line because I think you're right that you're right. That's kind of terrifying. One of the things that I wanted to, one of the things that I'm interested in better understanding is how we're managing protective services. And this might come under the sheriff's budget, but I want to make sure that we're really staying with our investment for the health and hospital system, with our partnership with the sheriff's office in terms of public safety. And I just want to put that out. I know that that's not, that wasn't on the list of cuts. I just wanted to make sure that that stays off the list, given that it's taken us a while to beef up the security.
I wonder, Supervisor, if it might be good to refer that issue to health and hospitals so that we can delve into it a little bit more. I think newer supervisors might not be as well aware of exactly what you're talking about, so it would be good to have it discussed and then forwarded to the board. I agree with you.
Yeah, that's really helpful, Dr. Smith. And I will just share that, you know, having our staff, reducing the number of incidents where our staff is at risk is really important. So yes, that's a really good idea. Thank you. And it was part of a referral that I made a bit ago. So we should be getting some sort of report back on overall incidents at, in our public health system. The last thing that I wanted to raise is the Child Advocacy Center. That was something that came to the board a while ago, actually. And I wanted to get a progress update on the plan, the staffing plan, and if it's possible, I'd like to get that before the end of the budget discussion, and it can come in an off-agenda report. I think that if it can't come back, I mean, if it's not easy to come back here to budget, maybe we hear it at a board meeting on the, I'm sorry, maybe we can hear it on the 18th here or at a board meeting before the end of the year.
We'll be happy to do that.
Thank you. Thank you. So, Greg, you will take us on our merry way.
Okay.
We'll go to the next item.
Next, we'll cover the technology services and solutions, and the recommended reductions from the county executive include the deletion of 29 positions to yield an ongoing savings of about 6.7 million overall in their internal service fund. We believe that will translate to around $2 million savings to the general fund and a little more than $4 million in savings to the hospital funds. At least 20 of these positions are expected to be vacant by March, and they include 4 positions in the social services vertical, 15 in the hospital system vertical, and 10 in their more general infrastructure and operations and IT business office, largely through a reorganization to deal with what was otherwise some duplications between their infrastructure and operations and business offices. So there's a lot of streamlining, I should say, intended with this reorganization. Service impacts, we do anticipate there will be department-wide impacts to a variety of applications and project portfolios. It will further happen some backlogs and maybe some other delays in deployment of some projects. And so we want to recognize that with this overall recommendation. Certainly the efficiencies that we're pursuing with the consolidation of infrastructure operations and IT business office vertical, we think is going to mitigate a lot of service impacts through some of the efficiencies that we're going to get there. And at this point, since this is a central service operation and eventually how this impacts our service organizations, whether the hospital agencies, it's kind of hard for at this point to be able to understand the racial equity, considerations. We're still learning also ourselves, how do we, when we take a look at changes in internal services, how do we want to understand the equity lens? Again, we're early in this process. We believe down the road we'll have a better way to kind of understand and measure equity impacts from central services. And at that point, that's our presentation for our last segment, the technology services and solutions cost reduction recommendations.
Great. Are there any public comments? I don't see any. Blair, is this on technology services and solutions? For if it's on that, then this would be the time to talk. So I'll go to the clerk and then back to the board for discussion.
The next speaker is B. Beekman. I am unmuting you. Please accept the unmute and you will have 2 minutes to speak. The timer will start when you begin speaking.
Hi, as this item, you're talking about cuts and it hurts. I've been incredibly impressed with yourselves, how you've tried so hard to maintain, a certain, what we can expect in services and what we just can expect of ourselves throughout this pandemic. The work that I try to be involved with the surveillance and technology ordinance ideas, it's part of the goals to be how do we continue our good practices and what exactly are our good practices and that can pull us through this time. And hopefully this time period is only going to be for another couple of years and that we're slowly addressing it now. I've heard the vaccination news, and so that's hopeful. From that, I think in the next, few years, we can really start to return to our regular practices again. And what will be the things that we're doing? We're thinking of a lot of things pre-COVID-19. We're trying to continue now. And I just wanted to comment, that the surveillance and technology ordinance has the idea to really pull us through a lot of difficult times. And it's based on peace and it's based on human relationships and developing those. It's not on business or money. It's based on our love of good practices, good democratic practices with each other. So I'm really sorry for these cuts that have happened today, or that will be happening with tech, and try to look for what are the things that are bringing us through this time. And thank you for your time.
This concludes the public speakers.
Thank you. I'm going to go back and see if any of my colleagues want to speak about TSS and the recommended cuts. Seeing none. What I would like to do is, I think just overall what I'd like to say is I think the equity analysis is a bit of a concern to me, and I apologize, I stepped away during the SSA presentation, but so there are two concerns I have. One is impacts to the intern and earn program, and two, that when we're looking at through a racial equity lens, given, one of the areas that we were looking at making cuts is in foster care and with the foster care system. And also, I think in that instance, we know that we're going to have a significant impact because almost all the children in our system are children of color. And so I just want to emphasize that I think those, right now, it's good that we're starting to ask the question, but the answers don't really seem to reflect the actual impact. And then the second issue I wanted to raise, and Dr. Smith, this is really something that I just wanted to have you help me think about a little longer term, is that, you know, one of the areas we've talked a lot about is what we do relative to homelessness, and I think, and appropriate placement for folks that are homeless. And so if we're looking at making a change, you know, a reduction in the public guardian's office, I hope that this also creates an opportunity for you and the staff to think about whether or not it makes sense to restructure these offices, and in particular, whether or not public guardian should be a standalone office so that it can be better coordinated with other departments that really need this service. And of course, this would be something we'd want to discuss with, you know, with our nonprofit partners, with the union, individuals who work there. But I hope that in the January timeframe, where you see opportunities to strengthen the service delivery model, recognizing we're cutting while we're trying to strengthen it, that you're able to pull those areas out and maybe get them going through committees so that they can be discussed, you know, with a strategic lens and also with the unions.
Yes, Supervisor, very good points. And I think, you know, from my previous comments, I've had concerns about the way the Public Guardian's Office is functioning and organized. As to your concern about the homeless and the mentally ill and those with behavioral issues, in most counties, those issues are often addressed by a fairly large number of so-called LPS conservatorships, which most counties use as a model to assure people are actually getting care rather than trying to go to the Laura's Law model. We don't do that many long-term LPS conservatorships, and that's been a concern to me for some time, as well as the fact that we do, I think, too many probate conservatorships. Now, of course, an hour from now, everybody in the Guardian's office will be calling me and yelling at me, but I think you bring up a good question, you know, are we doing it the best way possible? And we'll look at that.
Yeah, and I'd also like to have that thought about with the Department of Children and Family Services as well. And again, because of service coordination and whether or not it makes sense for that office to be independent. And I will just say to everybody listening, I'm not asking us to make those decisions today. All I'm really asking is, as we're put in this situation where we're making cuts, does it also give us an opportunity to think about service delivery models in collaboration with our partners, and I mean all of our partners, to determine whether or not this creates an opportunity for us to provide services better and in a more responsive way. So thank you for that.
Correct.
Seeing no other comments from my colleagues, I'm going to move to item 8, which is recess, and we will see everybody tomorrow here at 1:30. Thank you, everyone.
Thank you.